What are some of the triggers that you see that you notice that you tell people to watch out for?
So I would say the majority of my patients who get into episodes don't have triggers setting them off. But when I think about triggers, I think about either negative stress or positive stress. I will talk about positive stress first because this is often underappreciated. But when kids go on Christmas holiday to grandma's, that's often when it hits. When kids are going on a school trip, uh, with the other kids, or they're going overseas to Europe, that's often when it hits. So, I do find that, vacations or trips or disruptions in routine, which one would consider positive things, can sometimes set off episodes. Not always, not consistently, but something you got to think about. Doesn't mean you shouldn't go on trips. The negative stressors, I would say probably the most common one I see is related to school, related to tests, things like that. A, a school play sometimes, a track meet, things like that. And then the other kind of more obvious stressors are infections. So typically, upper respiratory infections, fevers, and things like that. And I think this is often why it gets misdiagnosed by pediatricians because a patient with CVS, there could be three other people in the family that have the same virus, giving them a little bit of nausea, vomiting, and diarrhea, but it might hit that child with CVS or adult with CVS a bit differently. And that's the child that's going to, again, vomit for a few days. So again, if a pediatrician, if a patient comes in once and a pediatrician says, yep, probably a virus, that's fine. But if they come in 5 times with the same thing, well, maybe you should think about something else.